what is the competency-based undergraduate curriculum? Describe and identify the microanatomical features of gastrointestinal system, esophagus, fundus, এটা যা আছে আছে এরপরে liver, gallbladder, pancreas, hepatobiliary system. Now, each individual, now they say you can get a question, I am telling you repeatedly, 5 marks, histology of liver. Even you will be given a slide in the under the microscope to see the microanatomy. Now, if you are given 5 marks for writing a short note on liver, then you have to give in just histological features of liver. Then you, whatever histology book you are discussing, you will be seeing the slide. That content you have to write. Not writing 3 pages, 4 pages, drawing a big liver, don't do that. You be to the point, you just say liver, how it looks, histology, what are the portal triad, what is the sinusoids, what are the hepatocytes, and you see with the why I am telling you how to correlate the microanatomy, like you see jaundice, hepatitis. Now, if it is hepatitis, if it is that, you have to get it through biochemistry. Okay. If there is in jaundice, you will be seeing it might be obstructive and non-obstructive. Obstructive and non-obstructive jaundice. Now, according to that, you have to go for an ultrasound. First, you go for an ultrasound and get what are the causes of that jaundice. Now, if there is any obstruction, now, say, if I back to Nama, well, relax, right there, relax. No. এই যে জুবেন আসবে ও কিন্তু গিটারটা নিয়ে ঘুরে বেড়াবে না. It comes with a special case, by air it will come, it will be transported, and on stage he'll get up and he'll carry that guitar. So you have to relax. Now, why I've drawn this? I'm just saying how the things change. Because see, it might be obstructive, non-obstructive. There can be a gallstone in the biliary pathway, or any stone, not gallstone, but gallstone, there might not be any gallstone, but it can be in the CBD, it can be in the hepatic ducts, it can be in the internal duct, biliary system, it can be. Now, if I catch his neck like this, okay, I catch his neck like this, he will do lagbe. Similarly, the cells in the liver, they react, and that goes to a pathological condition. Now, there might not be any stone, there might be a very small tumor in the CBD and the main pancreatic duct, opening into the ampulla of water. That's a small thing. There can be a stool lodged, that can be a tumor with obstructive jaundice. Now, after ultrasound, you are not getting any stones. Then you have to do an MRCP. Then you will find some pathology there, a tumor or some this thing, or a small stone is in between the thing, it is in the obstructed. Now that has to be taken out with ERCP. With a gastroduodenoscope, you put a scope and see and explore and visualize. You will see there might be a growth. Now, but you have to relieve the jaundice. Then what nowadays the surgeons are doing, এটা স্টমাক, এটা ডিউডেনাম, হ্যাঁ, এখান থেকে স্কোপটাকে বার করে এখানে এগুলোকে বার করে নেয়। They take out the stones. They take out the stones. The gastroenterologists. And if it is very difficult at times that all ERCPs are successful. So what the gastroenterologist does, they put a stent. They put a stent in the CBD, so the biliary drainages, the obstruction goes off to some extent, reduce the biliary and prepare for that surgery, a bypass. Okay, that means a portion এগুলো ইয়ে হবে, তারপরে এখানে জেজুনামের সঙ্গে স্টমাকের ইউনিয়ন হবে, so that you will be needing your surgery. But you see, and there might be this thing, hepatitis, but your HbA1c biochemistry you do, when a serology you do, that might not be positive even. It can be negative, but due to some cause, there will be your jaundice. So accordingly, you have to manage. And if there is any, your USG report gives that liver cancers or metastatic, any metastasis goes in the liver, a deposit there, that can be a sol there. So accordingly, you have to see, you do a fine needle aspiration cytology, FNSA of liver, FNSA of kidney. All this, just keep it in mind. Next year you will be doing it. Now, is the largest gland of the body, weighing 150 grams, modified exocrine gland with many other functions. Gross organization of liver supplied by hepatic artery, oxygenated blood and portal vein, blood from the gut, drained by hepatic veins into the inferior vena cava. Secretion of bile are collected by bile canal nuclei and carried out extrahepatic biliary apparatus. This is the extrahepatic biliary apparatus. Now, structural organization of liver. Liver shows following functional components: capsule and connective tissue stroma, parenchyma, hepatocytes, sinusoids and other blood vessels, and perisinusoidal space of Dicey, bile canal nuclei. The perisinusoidal space of Dicey, it can be an MCQ question. Okay, now I told you earlier that this is the, if you write this, the connective tissue capsule, liver is enclosed by connective tissue capsule, Glisson's capsule, MCQ. Now, connective tissue extends into the substance of the liver along with branches of portal vein, along with hepatic artery and reticular fibers, type 3 collagen fibers. Now, hepatocytes. Now, the liver cell, large polygonal 20 to 30 micron size, micromillimeter size. This is a viva. See, they have told you this is a viva question. That means it can be your the nuclei. Hepatocytes show large spherical nuclei that are present in the center of the cells. Nuclei shows huge euchromatin, open phase nuclei. As the cells is metabolically active, synthesizes proteins. Nuclei shows 1 to 2 nuclei. Many hepatocytes are binucleated, contains 4. This is neat, viva, neat. Lifespan 5 months. Regeneration capability, cytoplasm. It has regeneration capability. Cytoplasm is slightly acidophilic, eosinophilic. Now, the special stains, huge number of mitochondrial, vital staining, PAS staining, HNE staining for brown lipofuscin pigment. Surface of the liver cell shows following surface: synovial surface, canicular surface, and intercellular surface. So, not special stains and all, you don't bother. You are just be restricted to your HNE stain. You can recognize under the microscope with the simple HNE stain at least what liver is concerned at your level. For research or some more, you are doing histopathology, then you go for special stains and all. So you know your histological HNE stain. You please read in your leisure time, or not leisure time. You just spend 15 minutes, 10 minutes, just revise your histology. 10 minutes histology daily. So 36 slides. You see, put the atlas and your khata and you correlate. When you go to the lab, you draw just rough sketch. Hexagons gulo draw korbe. Hexagons gulo, you draw the hexagons and you see just make a line like this. Now what you will say, central cords of hepatocytes. Central vein is there. Central vein. Now this is red, this is corpuscles. Now portal triad here. There can be a question in portal triad. Interlobular branches of hepatic artery, portal vein, bile duct. You can write now. A portal triad. What is portal triad? When you write a short note, you mention portal triad, you mention hepatocytes, you will get your full marks. And how it appears, how it looks. আমি যখন বলছি তোমাদের দেখাচ্ছি তোমরা বলছো হয়ে গেছে এমনি করে দেখে নিলে ওরা একজন করে দেখে দিচ্ছে চলে যাচ্ছে ওখানে খাতা নিয়ে বই নিয়ে দেখা হয়ে গেল পাশে একটা ছাট ড্রয়িং করে নিলে স্কেচ করে নিলে এই যে আমি ধরো আমার এখন হ্যাবিট হয়ে গেছে আমি হোল প্রেসক্রিপশনে এটা কলাভবন আর্টিস্ট নই কিন্তু এই স্প্ল্যানেড পার্ক স্ট্রিট অঞ্চল মেলাতে দেখবে লোক পোর্ট্রেট আঁকছে ছাট স্কেচ করছে তো সেটা তারা আর্টিস্ট বাট দিস ইজ হোয়াট আই ডু you say one report has three this thing different pathological conditions. Now I just have a sketch. Now gallstone, then your bulky uterus with thickened cervix, and your there's a simple cyst of ovary. I draw and just label it. And yesterday, I saw a patient day before yesterday. Yes, yesterday the USG he did. He was complaining of she was complaining of abnormal uterine bleeding, and the report came bulky uterus and thickened endometrium, then simple cyst of ovary. Now, she was having 2 calculus, one in right kidney, Staghorn calculus, but non-obstructive. But she was similarly having a PUJ, but she did not complain of any disorder of the kidney. Now, PUJ, the pelvis and the ureter, there's a constriction. So, it needs an operation. Now, which I will put forward first? Of course, if I've given her 1 month medicine, if still she's having some problem, I will remove the uterus. By that time, next phase, I will be, previously I used to operate on kidney stones and all, but nowadays they are all endoscopic. Small, you make a slit here and you put the endoscope, you can take out. তাহলে প্ল্যানিং এগুলো কেন এত আমি সিরিয়াস, এতটা সিরিয়াস কেন? বিকজ সি you have to guide that person. You have to plan. So a good MBBS is a good PG. দিদি মাইনে বাড়িয়ে দিল, ইন্টার্নদের বাইরে আমাদের বোধহয় 300 টাকা ছিল, 250 না 300 না 500 টাকা ছিল, 500 টাকা ছিল। ইন্টার্নশিপে আমরা 500 টাকা করে পেয়েছি পার মান্থ। তো সেই টাকাটা আমি 100 টাকা দিয়েছিলাম আমার বউকে, মাই ওয়াইফ, আই গেভ 100 rupees, my mother 100 rupees, my father 100 rupees, and I kept 200 line share for me. 200 rupees I kept for myself. So তোমরা ভাববে না চাকরি পাবো কিনা, পাবো কিনা, এই ডোন্ট। আমি দেখেছি পরীক্ষার আগে বলছি যে আমার আর ভালো লাগছে না, আমার কি করব, এগুলো বলবে না। চাকরি হবেই, চাকরি না হলেও তুমি করবে, ডাক্তারি করবে, তোমার মহল্লাতে করবে। ওকে, কাম এইটা এই ছবিটা দেখে নাও, এইটা interlobular branches of hepatic artery, portal vein and bile duct. This, the portal triad. This is he has put a square like this and made this is your line and it puts in box. This he illustrated as how the portal triad is. Only this these hexagons you draw, but only one hexagon, 1, 2, 3, 3 hexagons you draw, and you put the portal triad main focus, but you just draw lines like this, just like this. এইখানে এরকম একটা, then you will just focus. Now you draw that diagram here like this.